Hello, my name's Rachel and I work for Step 2 Young People's Health. This video is about self-examination. So which parts of our body should we be examining then? Absolutely everybody, regardless of their gender, should be examining their breasts. Everybody has breast tissue, everybody can get breast cancer. Testicles, if you have them, you need to be checking those as well. For both of them, it's recommended that you check them at least once per month. There's some charities there, we'll talk more about those in a little bit, but these are some places that you can get some help, support and advice. There is absolutely nothing sexual about self-examination. Self-examination is not about you feeling yourself to get any kind of sexual pleasure. It's about making sure that you're safe, that you're healthy and that you're well. So, testicles. This particular picture is one that I've just taken from Google. There are absolutely loads. All I typed in was testicular self-exam. So if you don't like this picture for whatever reason, there are plenty of others out there. So this one is from Testicular Cancer Awareness Foundation and it tells you how you do your exam. You need to know what your testicles feel like if you have them, because otherwise you're not going to know if anything's different. Okay, it might be that you have a feel and then a couple of weeks later you notice something different and then a couple of weeks later it goes back to how it was before. There will be changes, but it's about knowing what they feel like the majority of the time so that you can pick up on something new. If you're in a long-term stable relationship, get your partner to have a feel as well. Make sure they know what they normally feel like, because during sexual activity they might pick up on the fact that something is different. They could be more likely to pick up on it than you are, and that could save your life. Okay, so everybody needs to know how to do breast exams. So again, these are images that I've just pulled from Google. You've got examples there of how a woman should check her breasts and how a man should check his breasts. Okay, so depending on which gender you were born in, at which point you are on your transition, if you are transgender, then you will know which of those you need to follow. Okay, so it tells you how to do both. Again, there are many different versions, especially for women online. However, men need to know that there's no shame in checking themselves for breast cancer. Lots of men go undiagnosed because they think they can't get it. You've also got the Know Your Lemons picture there, which gives you an idea of what breast cancer can look and feel like, the kinds of things that you should be looking out for. So there might be a vein somewhere. It might be that you've got a very obvious bump. It could be that actually there's some fluid coming out of your nipple, or that things are just a bit different to how they normally are. Lumps and changes in a woman's breasts especially don't always mean cancer. Women's breasts change during their menstrual cycle, so it could be that there's a difference because of that. But again, it's about knowing what yours normally feel like. It's about knowing how they change during your period. So for example, some women will get really sore breasts during their cycle. And if you know that's going to happen and you get that every month, then you're expecting that. However, if it happens at another point and that's really unusual for you, it's important that you know to keep an eye on that. Gentlemen, you should always try and check yours on the same day every month as well, because yours can change during various hormonal periods. Okay, and there's a perfect example there of how you should do it too. Okay, everybody needs to know that checking your breasts is really important. Okay, and for those with a vagina, you will also have vaginal discharge. And again, it's really important that you know what it looks like or what it might smell like at various points during your menstrual cycle. If you are worried about it, do get it checked. Okay, and if that's necessary, do get it treated. Don't ignore it because you think it's a little bit embarrassing. Okay, there are doctors who specialise in this kind of thing. They are used to seeing different types of vaginal discharge. That is what they get up and go to work for. By going to see them, you're helping to pay their mortgage. It's really important that you don't feel embarrassed. Roughly about half of the population has a vagina, and all of those people will have vaginal discharge. Everybody can have a normal, clear, sort of healthy discharge that can come at various points, but it's also the vagina cleaning itself. It's a really, really clever bit of your body. It's able to clean itself with this discharge. There are other examples of when things might not be quite right. So it could be that you've got a yeast infection. You might know that as thrush. It could be that there's a sexually transmitted infection. You might get discharge around various points of your period, so when it's just starting, when it's just ending. You might get a grey colour. That might again mean that you maybe need to go and see a GP or see a nurse and get yourself some treatment if necessary. It's absolutely fine to be a little bit concerned, okay? That's natural curiosity and concern is absolutely fine. But if you are worried, you must go and see somebody about it. Please don't put it off because it could lead to long-term problems. It's also possible to get discharge from the end of the penis. And again, it's better to be safe than sorry with this. People with a penis, please go get yourselves tested. It could be a sign that you have a sexually transmitted infection. It could be something else. You've got another diagram over here that tells you sort of common causes, and this mainly focuses on sexually transmitted infections. There are other reasons why guys might have an unusual discharge from their penis, but in many cases it could be an STI. Take note of the colour, take note of how often it's happening, take note of if it's got a funny smell, because all that information will be very helpful to the GP, the nurse, the sexual health advisor, whoever it is that you go and see. Okay, so some people get concerned about changes in the colour of their period. Again, this is totally normal. Okay, you will at various points during your period experience different things. So the bright red is the newest blood. Dark red tends to be what you get on a morning, first thing. Brown and black is the oldest blood, so that tends to come towards the end of the period. You might get spotting, which is where you just get little bits here and there. That might be pink. If it's orange, there's potential there that there is something wrong. I mean, it might not be that bright and orange. It might be a bit more dull and muted than that, sort of heading towards the brown. But if it's got a bit of an orangey tint to it, get it checked out just in case. And if it's purple, supposedly that's a sign of low fibre. So it might be that you just need to eat some more fruit and veg, or brown breads, potatoes, things like that that contain a lot of fibre. Again, it's totally normal for it to be different colours, different textures, different smells. It might be that, you know, your period lasts a few days, or you might be one of these people where your period lasts a full week. Again, that's absolutely fine. There's not a problem there. It's about you knowing what's normal for you. And they will get shorter over time. They tend to be quite long when you start, but they do get shorter as you get older. Okay, so on here I've just popped some information about support services that could be really helpful to you. That's us in the middle, Step 2 Young People's Health. You can see all our social media handles there. Feel free to follow us. We are a sexual health and mental health charity. If you wish to ask us questions, you can drop us a DM on any of those and we will get back to you. Cancer Research UK is on there because they have some really helpful information about breast tissue, about lumps on your testicles, etc. They're really quite helpful, but again, remember that just because you've got a lump, it does not mean you've got cancer. It's in the bag. They have some really helpful information about testicles, testicular cancer, checking your testicles, making sure that everything's okay down there. Copper Feel is a really good one for breast cancer and knowing what your breast tissue should feel like, as is the Know Your Lemons Foundation in the middle at the bottom there. The NHS obviously has a lot of very generalised information in this area and would be extremely helpful. Freedom for Girls, they have information about periods and support around menstruation and how that can affect your body. So again, they're quite a helpful charity.